Hi, my name is Rachel Maynor, and today I am going to tell you why federal funding for federally qualified health centers in America is so important. So, a federally qualified health center is a clinic, typically, usually located in a rural area. They can be other centers as well, but typically a medical desert where there's not a whole lot of access to care that is almost completely supported by the federal government. So the type of patients that you can see private insurance, but a lot of time you see Medicare, Medicaid, and self-pay patients there. So these patients do not always have other resources. They may not be able to afford anything else, even if they do have other resources. So these centers and these patients typically rely completely on the federal government. So the federal government is not only paying for like medications, they're helping pay for providers and nurses um, to treat these patients. Um, and if they do lose that funding, these patients have pretty much nowhere else to go. I mean, they can go to emergency rooms or urgent cares if they're like acutely sick, but they're not getting the basic screening that is done at these qualified health centers. So these federally qualified health centers, yes, they do acute visits, but they also look at, what is our risk for diabetes? What is our risk for hypertension? Do we have cancer? They do the colorectal cancer, like the FitGuard screenings. They do basically everything that another clinic would do, but they're very reliant on the federal government. And it is still, the policy still is in effect, but again, earlier this year it was kind of questionable. And I do work at one of these centers, and we were all like, oh my gosh, is everything about to not go, everything about to go down? So it was a very scary time. But again, these centers are so important because, yes, they do take care of the acute sick visits, but they look at the chronic and they try to prevent the diabetes from getting worse. So while it's kind of like, oh, they can go to other centers, a lot of patients can't, they can't afford it. And in the long run, the federally qualified health centers are taking care and reducing chronic disease that could only progress further. So if they don't have these centers, these diabetes and everything can get out of control. So these patients are going to be in the hospitals more, and they're going to create a greater strain on the healthcare system. So by supporting these centers, the federal government is helping reduce a strain on America's healthcare system, which is already pretty strained. So it's just very, very important that these centers remain funded and for everybody. Thank you.